What did you eat for breakfast this morning? Cereal, toast with bacon, a glass of orange juice, maybe some flavored yogurt from the fridge? Most of us do not think twice about what we eat before 9 in the morning. Breakfast feels safe, it feels routine. And after 60, many of us have been eating the same breakfast for years. But here is what I want you to consider today. After 60, the kidneys naturally work with less reserve than they did 2 decades ago, and the foods that seemed perfectly fine at 40 can start placing real pressure on the kidneys by the time we reach our 60s and 70s. Breakfast is often where that pressure begins, not because breakfast is dangerous in itself, but because so many common morning foods are quietly high in sodium, phosphorus, added sugar, or additives that can affect kidney function over time. I am Grace Wells, kidney and diabetes health educator for older adults. In today's video, I am going to walk you through 5 breakfast foods that many seniors over 60 eat regularly without realizing they may be placing extra stress on the kidneys. I will also share safer swaps and the right questions to bring to your next doctor's visit. One quick note before we begin. Everything I share today is educational only. It is not a replacement for your doctor's advice. Kidney health is highly individual. Your lab results, your CKD stage if you have one, your medications, your blood pressure, and your blood sugar all affect what is right for you specifically. Now, the last food on this list is the one most people miss because on the surface, it looks like a healthy choice. Stay with me through to the end. Here is something worth knowing before we get into the foods. Not every senior over 60 has kidney disease. Many people in their 60s and 70s have kidneys that are functioning reasonably well. But kidney function does naturally decline with age, even without disease. Research suggests that after 40, the kidneys gradually lose some of their filtering efficiency with each passing decade. That matters because it means even small, repeated stresses can become more significant over time. Things like consistently high sodium, regular blood sugar spikes, excess phosphorus from certain food additives. And here's the part that surprises a lot of people. Kidney concerns often have no obvious symptoms in the early stages. No pain, no fatigue, no clear warning. You may feel completely fine while your lab numbers are quietly changing. That is why breakfast foods for kidney health after 60 deserve attention before a problem appears, not only after a diagnosis. These patterns do not damage the kidneys overnight. But when the same high sodium, high phosphorus, high sugar breakfast happens every morning, day after day, it can show up in your labs before you ever feel a symptom. So let us go through the 5, starting with the one that is almost always in the refrigerator. The first food is processed breakfast meats, bacon, sausage, ham, breakfast turkey slices. For people over 60 who grew up with a cooked breakfast as part of a daily routine, these feel completely normal, familiar, even comforting. The concern is not the protein itself. The concern is the sodium. Processed breakfast meats are among the highest sodium foods in the grocery store. A few strips of bacon can carry 300 to 500 milligrams of sodium. A serving of sausage links similar. A slice of ham often the same. Many kidney health guidelines suggest adults with kidney concerns aim for no more than 1,500 to 2,000 milligrams of sodium per day, though your doctor may have a different target for you. What this means in practice is that by the time breakfast is over, you may have already used a third of your daily sodium budget and the day has barely started. High sodium over time is linked to elevated blood pressure, and high blood pressure is one of the leading contributors to kidney stress in older adults. The kidneys are responsible for filtering excess sodium from the blood. When sodium intake is consistently high, the kidneys have to work harder to manage that load. And after 60, that workload matters more than it did before. This does not mean you can never have bacon again. But if processed breakfast meats are an everyday habit, it may be worth asking your doctor whether pulling back could support your kidney health and your blood pressure numbers. Plain cooked eggs or a small portion of a lower sodium protein are options worth discussing with your doctor or renal dietitian. Now the second food, and this one is in nearly every pantry: sugary cereals and sweet pastries. Cereal at breakfast feels healthy. Words like whole grain, high fiber, and enriched are all over the boxes. And some cereals do have real nutritional value, but many popular cereals carry significant added sugar, and many also contain phosphorus additives that deserve a second look. For seniors managing blood sugar, or those who have been told they are pre-diabetic or diabetic, a bowl of sugary cereal in the morning can send blood glucose levels up quickly. Poorly controlled blood sugar over time is one of the most significant contributors to kidney stress. Diabetic kidney disease is, in fact, one of the most common forms of kidney disease in older adults. But the phosphorus piece matters too. Many cereals and commercial pastries contain phosphate additives, meaning phosphorus added during processing. These additives are absorbed into the bloodstream at a much higher rate than naturally occurring phosphorus in whole foods. For seniors with reduced kidney function, the kidneys may struggle to clear that excess phosphorus efficiently, which can affect bone health, heart health, and overall kidney workload. The item to look for on the ingredient label is any word containing the letters P, H, O, S: phosphate, dicalcium phosphate, disodium phosphate. These are signs of added phosphorus. If your doctor has ever mentioned watching your phosphorus levels, the cereal aisle is exactly where breakfast choices deserve closer attention. And if this made you think of the cereal box sitting on your counter right now, leave a comment below. Your experience could help another senior who has never thought to check that label. The third food is one many people feel genuinely shocked by because they grew up being told it was the healthy choice at the breakfast table. Large glasses of orange juice and other sweet drinks. Yes, orange juice has natural sugar, and for anyone managing blood sugar after 60, a large glass can cause a fast glucose spike. But that is not even the biggest concern here. Orange juice is naturally very high in potassium. A single 8-ounce glass contains roughly 400 to 500 milligrams of potassium, sometimes more in fortified versions. For most healthy adults, potassium is a beneficial mineral. But for seniors with reduced kidney function, the kidneys may not be able to clear excess potassium from the blood efficiently. When potassium builds up, a condition called hyperkalemia, it can affect the heart in ways that can become serious. If your doctor has ever mentioned watching your potassium levels, orange juice is one of the first morning drinks to bring up with them. The same concern applies to smoothies made with banana, orange, and mango, and to some wellness drinks marketed toward active seniors. Not every senior needs to restrict potassium. Your lab values are the guide. If your potassium is in the normal range and your kidney function is stable, a small glass of orange juice may not be a concern for you at all. This is exactly why individual lab results matter more than any general food list. But many people over 60 are drinking large glasses of orange juice every morning without knowing their current potassium numbers or whether their kidneys are clearing it well. That is the gap this video is here to close. A safer morning drink for many seniors is plain water. If you do want juice, ask your doctor whether a smaller portion of a lower potassium variety like apple juice fits your kidney health plan. The fourth food is the one I mentioned at the start, the one that surprises the most people because it genuinely looks healthy. Flavored yogurt with added sugar and phosphorus additives. Plain yogurt in the right portion can be a reasonable breakfast for many adults. Protein, calcium, sometimes probiotics. So far, so good. But flavored yogurt, the kind in little cups with fruit at the bottom, or marketed as a dessert-style breakfast, often tells a very different story on the nutrition label. Many flavored yogurts contain between 12 and 20 grams of added sugar per serving, sometimes more. For seniors managing blood sugar after 60, that is a meaningful glucose spike before 8 in the morning. And here is the part most people miss entirely. Many commercial yogurts contain phosphate additives to improve texture and shelf life. Even some yogurts marketed as health foods carry added phosphorus. Those additives are absorbed at a much higher rate than the phosphorus naturally found in dairy. This does not mean dairy is off the table, but that little container of strawberry yogurt that feels like a virtuous, health-conscious choice may deserve a closer look at the ingredient label. If you want a yogurt-based breakfast, plain low-fat yogurt with no added sugar or phosphate additives is the cleaner version to discuss with your doctor or dietitian. The pattern you may be noticing across all of these foods is the same. The processed, sweetened, and additive-heavy version of an otherwise ordinary food is almost always the more kidney-stressful version. That is not a coincidence. It is a reliable signal to watch for whether you are standing in the grocery aisle or reading a label at home. And now the fifth breakfast food, the most widespread offender and the one that rarely comes up in general health conversations. Salty packaged breakfast items. This category covers more than most people expect. Instant oatmeal packets, which many people assume are healthy, can contain 400 milligrams or more of sodium per serving. Plain steel-cut or old-fashioned rolled oats are a completely different food from those flavored, individually portioned packets. Frozen breakfast sandwiches with egg, cheese, and sausage can carry 800 to over 1,000 milligrams of sodium in a single item. Pre-made muffins and quick breads sold at coffee shops are often high in added sugar, sodium, and phosphate additives from commercial baking powder. Packaged breakfast biscuits and crackers marketed as a quick morning option. High in sodium, often containing phosphate additives. The pattern across all of these is the same. When food is packaged for convenience, sodium and phosphate additives are almost always part of how it is preserved and flavored. For seniors over 60 trying to support kidney health, the grab-and-go breakfast is one of the easiest places to unknowingly load up on both sodium and phosphorus before leaving the house. Plain oatmeal cooked from whole oats is genuinely one of the most kidney-friendly breakfast options for many seniors. Low in sodium, no phosphate additives, steady on blood sugar. Eggs prepared simply, without added salt or processed meat alongside, are another option worth discussing with your doctor. The rule of thumb is straightforward. The more processing that went into a food before it reached your table, the more that label is worth reading. So here is where we land. 5 breakfast foods that may place extra stress on the kidneys for seniors over 60. Processed breakfast meats for the sodium, sugary cereals and pastries for blood sugar spikes and phosphate additives, large glasses of orange juice for the potassium load, flavored yogurt for added sugar and hidden phosphorus additives, and salty packaged breakfast items which combine both sodium and phosphate additives in one convenient package. None of this means a single bowl of cereal will cause kidney disease. That is not how it works. What it means is that patterns matter. What you eat every morning, repeated over months and years, can show up in your labs before you ever feel a symptom, especially after 60. The goal is not fear, it is awareness. Here are 3 questions worth writing down before your next doctor or dietitian visit. Based on my lab results and kidney function, are there specific breakfast nutrients I should be limiting, such as sodium, phosphorus, potassium, or protein? Do any of my current medications interact with high potassium or high phosphorus foods in the morning? Would a referral to a renal dietitian be appropriate for me right now? Those 3 questions can open a conversation many seniors never have simply because no one told them it was worth asking. If one sentence in this video helped you think of a better question to bring to your next appointment, then this video did exactly what I hoped it would. Before you go, here is one practical step you can take before tomorrow morning. Check what you drink first, not your food, just your first drink of the day. Is it juice? A flavored drink? Something with added sugars or potassium listed on the label? That one small check costs nothing, and it is a starting point. If you also want to make one change to your morning plate, consider swapping one packaged item for something with fewer ingredients. Plain oats instead of an instant packet, an egg instead of a breakfast sandwich. One swap at a time, discussed with your doctor if needed. One label. One question at your next appointment. That is how kidney health after 60 is supported, not with a dramatic overhaul of everything at once, but with steady, informed choices made one morning at a time. A brief medical note before I close. Everything in this video is educational information only. It is not a diagnosis, a treatment plan, or a substitute for your doctor's guidance. Please speak with your doctor or a registered renal dietitian before making significant changes to your diet. What is your usual breakfast after 60? Cereal, toast, eggs, oatmeal, yogurt, bacon, or coffee? Leave your answer in the comments below. Your morning routine might be exactly what another senior needs to read today. Tomorrow, we are covering 7 drinks that seniors should be careful with for kidney health after 60, and some of them are not the ones you are expecting, not just soda or alcohol. Some are actively being marketed as health drinks right now, and they deserve a closer look for anyone over 60 managing their kidney health. If that sounds like something worth knowing, staying connected to this channel is a natural next step. I am Grace Wells. Take care of your mornings, and I will see you in the next video.